So our learning objectives today is we're going to define workplace violence. We're going to understand risk assessments and identify potential triggers. We're going to recognize escalating behaviors. We're going to apply de-escalating strategies to manage escalating behaviors. And we're going to implement safety strategies in response to potentially violent situations. Sorry, somebody muted my microphone. Can you guys hear me?
Yep, we can hear you.
Thank you.
Yes, I can hear you.
Okay, so workplace violence per the Occupational Health and Safety Act. Workplace violence is the exercise of physical force by a person against a worker in a workplace that causes or could cause real physical injury to the worker. An attempt to exercise physical force against a worker in a workplace that could cause physical injury to the worker, or a statement or behavior that is reasonable for a worker to interpret as a threat that can exercise physical force against the worker in the workplace that could cause physical injury to the worker. Okay? And we'll talk about this, and these will become nice and clear as we go on. So risk assessment. Individual assessments can help identify triggers that could lead to or escalate violent, aggressive, or responsive behaviors. So what are some examples of triggers you have encountered? So physical. What are some of the physical triggers you guys have encountered, guys? Like infection could be one of them. If the client has an infection, it could cause them to be physical. If they have a new medication, it can cause them to be physical. Oops. Okay. What other things can be physical?
If they're not feeling well, if they are tired, didn't have a good night's sleep, they might be feeling irritated.
Good. Psychological. What examples of triggers have you encountered for psychological? Like some of the examples here is feeling a loss of control, feeling like you're being lectured or told to calm down. What other things can cause you to trigger an unwanted response from a client, or a client can trigger an unwanted response from themselves? Maybe being in public or being in front of people that they respect and they're not able to have the control that they want to, even though it's under loss of control, being lectured, not being in a private spot.
There's anxiety and being pain in the chat as well, confusion.
Absolutely, excellent. Okay, and environmental. So what examples of triggers for environmental have you encountered? So we look at sensory factors, privacy, time of day. What other things do you want to add on to there?
Being in a new space, like if they've recently moved to a new apartment or something, or moved to a new house.
Very good. Anybody else?
Being rushed.
Yeah. Why would time of day be be environmental? Some people, we've heard of dementia having sundown effect, where, as the day gets on and it gets closer to nighttime, people's behaviors can exacerbate, or they can be tired or later in the day, or they might not be a morning person and are grumpy already in the morning, and that could be an influence as well. Okay, and activity, personal care, past experiences, routine changes, and resistance. Are there any other triggers that you can think of for activity? What about cultural? Some clients, can't have males or can't have females, and that could exacerbate a triggered response, right? Okay, good.
Showing up at a different time than another worker.
Absolutely. So identifying escalating behaviors. So when we look at identifying escalating behaviors, we look at the behaviors of making verbal threats. So the characteristics of that would be like raising voice in an intimidating or threatening way, shouts angrily. It can be insulting others, swearing, making aggressive sounds, making threats, verbal threats. A behavior of making physical threats. So how does that look like? Raising the arms or legs in an aggressive or agitated way, making a fist, taking an aggressive stance, moving or lunging forcefully towards others. When we look at the behaviors of attacking objects, we look at throwing objects, banging or breaking windows, kicking objects, smashing furniture, throwing objects, acting agitated or impulsive, unable to remain composed, quick to overreact to real or imagined disappointments. They can seem troubled, nervous, restless, upset. It can be spontaneous. It can be hasty. It can be emotional. Does anybody want to add anything to these?
When a client actually becomes more quiet than they normally are,
Yeah,
they become more silent, they're not engaging.
agreed. And they can be unpredictable that way too. Very good. So behavior escalation stages. So you have a baseline, then you have anxious, verbal, physical, and then you have a recovery. So it kind of has a bit of a curve line here. Oops, let me go back here. Okay. So let's talk about this. So let's identify. So fear and anxiety, how does that look? We can see a subtle change in affect and behavior. They can be fidgeting, pacing, wandering. They can have repetitive behaviors like wringing their hands or, constantly grabbing the arm rails or playing with their clothes, limiting eye contact. Any other identifiers for fear and anxiety?
Yes, swearing, using bad language.
Yeah, good.
Refusing care.
Refusing care.
Rocking back and forth is in the chat.
Yeah, good. So questions to ask ourselves. What cues or unmet needs are driving the behavior? So you want to think like, okay, is there something I'm not seeing here? And how can I address them? How can I validate the person's feelings while respecting their privacy? Is there any other questions we might want to ask ourselves?
I think possibly looking at like their facial expressions and that, and actually what they're doing. It could be signs of pain and stuff like that as well.
Yeah, exactly. So we want to look at those nonverbal cues as well. And so a caregiver response, oops, where'd my mouse go here? Hang on a minute.
One of the questions in the chat to ask yourself is there possible infection? So you might want to pay attention. And also step back.
Okay, good. Sorry.
You can also ask.
I'm having some technical issues with my mouse. It doesn't seem to want to come onto the PowerPoint here. So caregiver response, use a calm, friendly approach, acknowledge and validate concerns, identify and address the triggers, and refocus attention. Okay, does anybody have anything else they want to add to this?
Ask open-ended questions.
Yeah.
Sorry, Deborah.
I was just going to say, try not to make any sudden movements and give them a little space while you continue to assess and let them express what's going on.
Yeah, and don't come up behind them, right?
Just take a break if they need it. If they're not responding very well, then just stop and give them a minute to regroup.
Good. Okay, so identifying the escalating behavior, verbally or physically resistant. So the identifiers is losing rationality, they're argumentative, unable to hear or follow simple directions, hostile responses, verbal threats. Are there any other identifiers you might want to add on to this?
They could stiffen up.
Yeah. Okay, so questions to ask ourselves. How can you stay calm and adjust communication while respecting personal space? And how can you direct bystanders to safety? When you're thinking about this too, one of the other things you want to ask yourself is, where am I in relation to the door? Question to yourself is, there always should be a clear path for yourself to the door. Okay, and caregiver response is always try and provide guidance, remain calm but firm, give clear and simple directions, provide reasonable limits, remove spectators. Why is that important?
So the client doesn't feel embarrassed.
Exactly. And also it decreases the amount of stimuli that's there, right? It just becomes you and them rather than what's going on elsewhere. Good. Physical aggression. Identifiers, danger to self or others, complete loss of control. It has potential for injury to the person or property. Is there any other physical aggression?
Hitting.
Questions to ask ourselves. What is the risk, and should you step in or step back? How can you stay calm, call for help, or use de-escalation techniques safely? Are we safe?
Others nearby can help as well.
Exactly. And caregiver response is activate safety protocols, alert team members, observe from a distance and keep others away from harm, and remain alert to personal threat. So you want to make sure that there's a little bit of space between you and that person. Okay. Tension reduction. So identifiers would be physically and emotionally drained after all of this, that right, the tension reduces, so they become physically and emotionally drained. They can be self-conscious, they can be humiliated. What are other things that can identify a tension reduction? Is there anything on the chat? Okay, questions to ask yourself. How can you off? Somebody's got their microphone on. Can you please turn your microphone off? Thank you. Questions to ask yourselves. How can I offer comfort and support after de-escalation? How will I watch for re-escalation and debrief with your team? Any thoughts on this?
Maybe speak calmly with the client, see what caused this to happen.
Yeah, good. And the caregiver response.
to stay calm and listen to the client.
Exactly. Reestablish communication, offer emotional support to all involved, be non-judgmental, lead or request a debrief, and make sure you develop a care plan. You want to make sure you document what are the triggers and what works. Okay, next. So we have this video here, if I can get it to work. Okay.
When faced with a client who has dementia and exhibiting expressive or responsive behaviors.
In the warm and comforting atmosphere of a shared home, Mrs. Smith, a lovely lady living with dementia, found solace in the presence of her fellow residents. Among these residents was a dedicated healthcare worker, HCW, deeply committed to their well-being. The time had come for Mrs. Smith to receive her medication. Approaching Mrs. Smith, the HCW greeted her and suggested that it was time to return to her room for her medication. However, a sudden wave of fear surged through Mrs. Smith, causing her to react with agitation, explaining, "No, go away." In her distress, she accidentally struck out at the HCW. Understanding the need for a non-confrontational approach, the HCW took a step back and reiterated the importance of the medication for Mrs. Smith's well-being. Mrs. Smith, still agitated, says, "I don't want your medicine." Despite Mrs. Smith's continued agitation and refusal, among the onlookers, Mr. Jones, a highly respected elder within the community, felt a sense of duty to intervene. Holding his cane, he approached the scene, poised to protect Mrs. Smith. He comes closer and furiously taps the HCW with his cane.
Dealing with aggressive behavior in home care situations requires the right techniques. In the next video, we will discuss the actions that were missed and how to handle such situations effectively. When faced with a client who has dementia and exhibiting expressive or responsive behaviors.
In the warm and comforting atmosphere of a shared home, Mrs. Smith, a lovely lady living with dementia, found solace in the presence of her fellow residents. Among these residents was a dedicated healthcare worker, HCW, deeply committed to their well-being. The time had come for Mrs. Smith to receive her medication. Approaching Mrs. Smith, the HCW greeted her and suggested that it was time to return to her room for her medication. However, a sudden wave of fear surged through Mrs. Smith, causing her to react with agitation, explaining, "No, go away." In her distress, she accidentally struck out at the HCW. Understanding the need for a non-confrontational approach, the HCW took a step back and reiterated the importance of the medication for Mrs. Smith's well-being. Mrs. Smith, still agitated, says, "I don't want your medicine." Despite Mrs. Smith's continued agitation and refusal, among the onlookers, Mr. Jones, a highly respected elder within the community, felt a sense of duty to intervene. Holding his cane, he approached the scene, poised to protect Mrs. Smith. He comes closer and furiously taps the HCW with his cane.
Dealing with aggressive behavior in home care situations requires the right techniques. In the next video, we will discuss the actions that were missed and how to handle such situations effectively.
So, what did the healthcare worker do well?
Step back.
Okay. What else did he do?
Got down to the client's eye level where they could see face to face instead of looking down on her.
Okay. What were some possible triggers that could have escalated the client's behavior?
Being around other people.
Yeah. What else?
Not announcing that he was coming to talk to her, like as he was approaching her.
Okay, good.
Wanting her to leave the
Did she?
area because obviously she was comfortable there, right? So having her move when she was fine.
Yeah, good. And what could the health provider have done differently to prioritize safety?
He wasn't looking behind him.
Right. Remember what we said? That direct line between you and the door? What's behind you? Okay, good. Okay. De-escalation disengagement techniques. So when we look at this, we look at de-escalation disengagement techniques. So number one, be empathetic and non-judgmental. Use non-threatening, non-verbal communication. You want to make sure that your body language is not tense and stressed because they'll pick that up. Avoid overreacting. Try to be calm. Respect the personal space. Remember a few years ago, people used to talk about bubbles of space. Try and respect that person's bubble. Focus on feelings. How do you feel? Response to challenging questions and set boundaries. Choose wisely what you insist on. In other words, pick your battles. Allow silence for reflection and provide time for decisions. So when we're empathetic and judgmental, you introduce yourself and explain your actions. Consider cognitive conditions that might affect behavior. Do they have dementia? Have they had a stroke? Do they understand? Do they understand your language? Don't judge, recognize that their feelings are real, acknowledge the situation's importance to them, and stay calm and avoid arguing or criticizing. So you could say, I hear you and understand this is important to you. Avoid saying you're wrong and no, that's not what I said. Use non-threatening, non-verbal communication. As a person loses control, they respond more to non-verbal cues than words. Be mindful of gestures, facial expression, movements, and tone. You want to make sure that your body language, your facial expressions are all matching your voice tone and the messages you want to convey. Use open body language to show calm, respect, and attentiveness. You don't want to be standing there with your legs crossed at the ankles, your arms crossed across your arm with a big frown on your face. Practice active listening, nod to show understanding. Think positively, such as, I can manage this, or I know how to handle it, and it will help you stay calm and rational, which in turn can help calm the other person. Closed versus open posture considerations. So closed posture, it can be perceived as being hostile, unfriendly. It can be anxiety provoking, whereas open posture, where your legs are open, your arms are open, it may indicate friendliness, openness, a willingness to learn. We always assess people on many different levels, not just verbal, but also nonverbal, overt and covert things. Avoid overreacting. Stay calm, rational, professional. Your response influences whether the situation escalates or de-escalates. If you stay calm, it's a lot easier to diffuse a situation than if you're raising your voice too. Be mindful of your behavior. The person will sense your kindness or your frustration. Keeping your tone and body language neutral will go a long way towards diffusing a situation. Respect personal space. Allowing personal space tends to decrease a person's anxiety. If you're standing right over top of them in their personal space, it's a lot harder for them to calm down. And it's a lot harder for you to calm down too. If possible, stand 1.5 to 3 feet away from a person who is escalating. Maintain a safe distance and avoid touching the other person during this time. Think positively to yourself, such as, I can manage this, or I know how to handle it, and it will help you stay calm and rational, which in turn can help the other person. Interpersonal space. So remember we talked about that little bubble space? So you have your intimate space, which is less than 1.5 feet or 0.45 meters. Who would normally be in an intimate space?
Your partner, or maybe your kids.
Yeah. Spouse, yeah. Personal space, 1.5 feet to 4 feet. Who would normally be in this personal space?
Your friends, family.
Caregiver? Unknown caregiver?
Yeah.
Social space. 4 feet to 12 feet. Who would be in your social space?
Maybe someone you're just having a chat with.
Yeah, some of you don't know very well, right? Public space. 12 feet to 25 feet.
People at
Anyone
Walmart.
could be in the area.
Everyone else?
Yep, everybody else. Absolutely. Okay, focus on feelings. Focus on how the person feels, not just the facts. Understand the root cause of their frustration. Acknowledge the feelings behind the behavior. And use reflective comments to show you've heard their concerns. Really pay close attention to both their words and actions to understand the person's true message. Use compassionate language such as, "That must be frustrating," or "I appreciate you sharing that with me." Avoid dismissive phrases like, "That's silly," or "You have no reason to feel that way." We don't want to negate them or cause them to re-escalate. Response to challenging questions. So challenging questions might include, why do we have to do this? And who's going to make me? Answering these often leads to a power struggle. Instead, set clear boundaries and redirect their focus to issue at hand. Okay? Disregard the challenge itself, but remain focused on the person. Shift their attention to how you can collaborate to find a solution. Set boundaries. Set clear, enforceable limits for disruptive behavior. Offer respectful choices and consequences. Be flexible to promote positive change. Listening helps set more meaningful limits by understanding their feelings. When someone's upset, they may struggle to focus on everything you say. So try and be clear. Keep your words simple and offer the positive options first. Choose widely what you insist upon, or as I call it, pick your battles. Be thoughtful about what is negotiable and what is non-negotiable. Clearly state that abusive language or behavior is unacceptable, but only if it won't escalate things. Consider flexible options like rescheduling tasks or involving a familiar person for support. Providing a person with options and flexibility can help prevent unnecessary conflicts. Allow silence for reflection. Allowing moments of silence can be helpful. It gives the person time to reflect and decide how to proceed. We also know that sometimes silence decreases the amount of other stimuli, and that in itself can help de-escalate situations. Offer a person options and flexibility can help prevent unnecessary conflicts. Allow time for decisions. When someone is upset, they may need a few minutes to process what you've said. Give them that time to think clearly. When a person feels rushed, their stress levels increase. Allowing time can help reduce stress and promote calm. Prioritize your safety. In situations where you feel threatened or face imminent violence, threats of assault, harm, or disorderly contact, you need to end the interaction. You need to prioritize the safety of yourselves and others nearby if applicable, and you need to distance yourself from the source of harm. Posture and position considerations. You need to maintain a safe, adjustable distance. Use open, non-threatening body language. Keep hands visible and move slowly. Respect the personal space and pay attention to nonverbal cues. So what safety steps should we take in each of the following workplace environments to ensure our own safety? What are some things that we can think about in home and community? Any thoughts?
Know where the exits are.
Know where the exits are. Yeah. You can leave and go to a safe place. You can call 911 or if in immediate danger, always notify your manager if there's been an issue. Okay. What about the office and clinic? Move to a room with a locked door. Call 911 if in imminent danger. Notify a manager. Keep your phone handy. Keep it in your pocket at all times. So if you ever need it, it's available. Okay. Phone. If someone is escalating on the phone, inform the caller in a tone and comments, and tell them that their tone and comments are unacceptable. End the call if it proceeds and notify a manager. Always let them know that, hey, Mr. Brown, you know, if you continue to yell at me, I will need to hang up. Let them know that that's what's going to happen. Okay. A manager must be notified of all workplace violence incidents to ensure proper reporting, follow-up actions, and any necessary adjustments to care plans. So if it's verbal, you can send an email or leave a voicemail. If it's physical, you should be talking to a manager, okay? Because they're going to need to have more questions. You might need to seek medical help, okay? All right, we've got another video here. You ready?
Our story begins at the stroke of 9, where expectations meet the unexpected.
Good morning. I'm Jay, and I am here for Mrs. Lee's personal care services scheduled for 9 a.m.
Hey, Jay. I'm Mrs. Lee. This is my son, Chad.
Why didn't anyone contact us last night to schedule this visit?
We did call the number provided, and the visit was scheduled with your mother, Mrs. Lee herself.
You're lying. This can't be. I'm calling the primary caregiver and the manager.
I understand your concerns. Let me step outside and verify the details for you.
Okay, thoughts?
Our story begins at the stroke of 9, where expectations meet the unexpected.
Okay, next. I'm just going to go to next here. Okay, so scenario 2 questions. What did the healthcare provider do well?
Stepped out of the house.
Mm-hmm.
He introduced
Acknowledge
himself.
his frustration.
Acknowledge the frustration, yeah. Somebody else?
He introduced himself and what he was there to do.
Yeah. Okay, good. What could the healthcare provider have done differently to prioritize safety?
Close the door.
Close the door, yeah. Or?
Turned around and watched the entrance.
Yeah, not put his back to the door. Yeah, good. All right. Employee support. Staff are encouraged to utilize the available support resources that we have, including Employee Assistance Program. It's available 24 hours a day, 7 days a week. The options to call or text. Spiritual care services. It's access to individual group sessions with the St. Elizabeth spiritual care person. Self-care resources. There's programs, toolkits, and webinars to support well-being. And we do have these on our At Your Side colleague, as well as an OC Health. TELUS Health EAP website, and the St. Elizabeth Wellness Hub. So the knowledge test. So that's Natasha's little thing here. So Natasha?
Right, just give me 1 second.
So in order to be considered complete in this course, you need to do the knowledge test, and then you'll get a certificate for that, okay? You can do the knowledge test as soon as you're able to do so. Well, it's all fresh in your mind. That'd be great. And Natasha is putting the link in the chat. Okay, for y'all? You can find this PowerPoint presentation in the knowledge test via the link, or you can actually go on MySC and then go into At Your Side Colleague, and then click under the staff part, click your name, and it'll be there. And you can just click on the presentation and then click on the knowledge test. Okay, hang in there, Harmony. You may get it, a little bit later. Okay, your certificate. Sometimes there's a bit of a delay to it. Sometimes you get them, sometimes you don't. We've had people say they got them, and we've had people say they didn't. You're welcome.
Okay, so the link is in the chat there. So y'all can click on the link.
Natasha, we got attendance, right?
Yes, it's automatic. So once everyone leaves the meeting, then we'll have the report there.
Okay, and then we'll send it to your desks. For those of you that are not in clinic, we'll send it to your desk. You get paid for the meeting. Those that are in clinic, it should be included in part of your day.
I did notice there are a few of you that might have joined in a different account than your SC account, so it doesn't show your last name. So I would suggest reaching out to your manager just to let them know that you did attend.
And you do not need to send your certificate to anybody. All right. If you're done, you can go. Or you can go and do your knowledge test a little bit later, whichever works best for you.
Thanks, Lorraine and Natasha.
You're welcome. Thank you.
Thank you.
Sorry, did you say we need to notify our supervisor we've done this?
You should be fine, Deborah. Only there's just some that it shows that they're unverified, so we don't know exactly who they are. For example,
okay. All right, because I already had all this completed before, so I'm good to go then.
You're good to go.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Dovie. No, this is slightly different. I think this, well, yeah, if you did in 2024 December, you should be okay, because there was a presentation done in December. I forgot about that one.